Good morning, friends. Samir Gupta again, on your host for the day. And today's topic that we are talking about is exclusions you must know in health insurance in India. Until now, we have understood in the last 1 week how to choose the company, how to choose the plan, whether we should go for family floater, which kind of family floater we should go about, and all that. Today, we will learn a very important aspect of health insurance, which is exclusions, what are not covered at all in insurance. So, let us understand uh, from a common man's perspective things which are not covered and what are the limitations that health insurance has. Probably, if you see whichever ad that you see, whenever you see read a newspaper ad, a TV ad, or whatever, there's mentioned TNC apply. But thanks to IRD and thanks to the government of India, they have very clearly mentioned that there should not be any TNC apply in any of the policies, wordings, and the coverages. So it is very, very clear and transparent. Mentioned whatever is covered is mentioned there. Whatever is not to be covered also is mentioned there in the policy document. I am sure none of us have read the policy document after buying the insurance. But once we go through that, whatever I am mentioning today have been very clearly defined in what is not covered in the insurance policy. So that is one reason why I always say there are no surprises after we go in for a claim. And during the claim also, when the company says, Sorry sir, this is not payable," it has been clearly defined as per law what covered and what is not covered and what is not payable. So let us understand some things uh, that probably the term used in insurance for this particular thing what is not covered is called exclusions. Excluded in the policy is called exclusions. So this is one thing that they use, and there are two types of exclusions in a policy. One are general exclusions and one are permanent exclusions. General exclusions are applicable after taking the policy. When I say general exclusion, these are exclusions applicable to all policy holders after taking the policy, and permanent exclusions are conditions which are probably not covered at all. So, if somebody has these permanent exclusion conditions, they are supposed not to be insurable. That is the idea, and that is how it works. So let us understand each one in detail. Let's start with general exclusions first. To start off with, the first general exclusion that I probably would say is plastic surgeries. Until unless the surgery is happening because of an result of an accident, result of an injury, plastic surgeries are clearly no in health insurance. No insurance company is supposed to cover plastic surgeries if it is not due to an accident or not due to an injury. So plastic surgeries are completely no in health insurance policies. Then we have cosmetic surgeries. Maybe somebody, when I say plastic surgery, supposing you have a deformity, you have a big nose like mine, then you want to make it small, you want to cut it down, and not possible by not covered under insurance. You can get it done, but still not covered under insurance. That is a simple example of a plastic surgery. In a cosmetic surgery, I would say that probably you have a scar on your face or on your body and you want to cover that through cosmetic surgery, or want to relieve it, or you want to clear it off with cosmetic surgery. You don't have hair and you want to do hair weaving or hair transplant. That again is a cosmetic surgery. Your skin color is black and you want to do pigmentation surgery, and that is what is called cosmetic surgery. So these are all cosmetic surgeries and they are not covered under any insurance policy in India. These are very clearly defined as not included conditions. Then there are something called investigative and evaluative consultations. Supposing you have a pain in the body, maybe back pain, maybe a shoulder pain, chest pain, any kind of a pain, and you go to a doctor and ask him, doctor, you visit a doctor, and doctor says, let's do a MRI or a scan, and then come back and see, let us see what is it. So these things, even the consultation of the doctor, and then beyond consultation, the investigative diagnostics are also not covered under insurance because they don't lead to hospitalization. And until and unless it doesn't lead to hospitalization, it is not covered. So that is the idea, that these things are not covered under insurance. Then we have intentional self-inflicted injuries. Now, when I say self-inflicted injuries, somebody intentionally hurts himself intentionally and gets hospitalized. Uh, Many a times we have seen in young people, out of stress or out of anger, they hurt themselves. They go bang the wall. They hit their head on the wall. Something happens at home, and they just go uh, show off, hit the glass, mirror. Sometimes you are so engrossed in the movie that whatever the hero in the movie does, you want to do the same thing and you show off. So these are all self-inflicted injuries which are not covered under insurance. The reason, because you have wantingly done some kind of experiment or something like that, these are not covered and they are excluded from the policy. Inpatient hospitalization. When I say IP means inpatient hospitalization. This is very, very important. You have to understand that if your hospitalization is due to drug or alcohol abuse, if you are hospitalized due to a drug abuse or alcohol abuse, and even if you are hospitalized for rehabilitation of drug and alcohol abuse, both are not covered. Both conditions, whether you are hospitalized because of alcohol and drug abuse, or if you are hospitalized for rehabilitation of drug and alcohol abuse, even that is not covered under insurance in India. Then another important thing that you have to understand is the gender change treatments. Many a times there are people who have, I think, a common and very famous example is Michael Jackson. He had multiple times sex change treatments done on his body, from male to female and female to male and things like that. So these things are not covered under insurance. Any health insurance, they are not covered under that insurance in India. And you have to understand that these are because of our own passion, need, aspirations, we do that, but they are not very no to in health insurance. Obesity, probably overweight, or weight loss treatments. Now, when I say obesity treatment, recently, last 2 years back, if I'm not wrong, the government of India has approved obesity and weight loss treatments are not covered under insurance. Now, rehabilitation or rest cure. Now, you see, there are multiple nature cure hospitals where we go for rehabilitation. There are some places where you go to de-stress yourself. These conditions, these hospitalizations also cost a good amount of money, but they are not covered under insurance. So you have to understand Panchakarma treatment in Ayurveda, your illness and wellness treatments within the Ayurvedic or Ayush spa. We go to basic spas, we go to Thai spa and all that for massages. These are not covered under insurance. Then we have something very, very important, hazardous hobbies or adventure sports, and hospitalization due to those injuries. Hazardous hobbies like bungee jumping, scuba diving, adventure sport like skydiving and all, these are not covered under insurance. Then we have racing and motorsports. These also come under adventure sports and these are not covered under insurance. Any injury due to unethical or illegal activities. When I say illegal, supposing you are injured during in illegal activity that you are carrying out, and you get shoot out, or you fall from the vehicle, or you are injured for whatever reason in during an illegal activity, you are not covered under insurance, and you have to ensure that very clearly they say if it is illegal, it is not covered. Congenital disease and conditions. When I say congenital diseases, anything that is by birth. Supposing there is some defect in the heart by birth, you may still live a normal life. Nobody may know about it. You may not be aware of it, and you may get to know about it only at a very later stage, very, very later stage, like maybe after 20 years, 25 years. But the fact that if you are aware of it, then they are not covered. The only thing that you are, if you are, until unless you are not aware of it up to a certain age, then they do cover that. Most of the times, I would say 99% of the times, the moment you mention that, the doctor mentions that as congenital disease, they are not covered under insurance. So we have to be very clear on that. Uh, this is again very important. Probably, if you remember Hiroshima and Nagasaki, the bomb blast that happened there, the blast Vajpayee government did in the nuclear blast that happened in India during their regime to just do the testing. That also, if you are affected because of that and you get hospitalized due to the effect of that blast, anything to do with nuclear blast or substance, you are not covered under insurance. So that is again another is very strong and important point. Then we have circumcision. If Until unless it is not prescribed by a general medical practitioner for some infection or other reasons, that some other disease, and it leads to circumcision, then it is covered. Otherwise, if it is self circumcision out of your own interest, then it is not covered. uh, when you're hospitalized, any charges that the hospital charges for registration, admission, record maintenance, and telephone charges, if they apply in your bills, they are not covered under insurance. No company can cover these charges under insurance. They are very clearly mentioned not to be paid. So then, certain conditions like during COVID, people were trying out different medicines. So, pandemic, the government allowed such things, but in a normal routine life, unconventional, untested, unproven, and experimental therapies are very clearly not insurable. They Until unless they are not approved by the authorities or the board, IMA, or we call the US Federation, FDA, if they are not approved, then they are not covered under insurance. Any injuries during war, if it happens to the insured person, they are not covered under insurance. Government may give them subsidy, or the government will give them whatever care they have to take care of. The government would take care of, but insurance does not cover war. Uh, then there are certain excluded providers. When I say excluded providers, they don't. There are hospitals. There are, I would say, centers. There are kind of alternate medicine therapies, treatments. Uh, these are not covered. They are not covered under insurance. Supposing you go to a excluded provider. When it's excluded provider, this provider has been blacklisted by all the insurance companies, and you still go to that same provider, hospital, and then you go and say, I want to claim insurance there. That is very clearly mentioned. It will not be covered under insurance. So this is something that we have to understand. Please check out when you are getting admitted the details of the hospital, whether it is excluded or not. If it is excluded provider, please avoid such hospitals. Then we have refractive error treatments. Probably you know that we call it power. Someone has negative power, someone has positive power, someone has near can't read near to him, someone can't see far. So there are refractive errors. These are not covered under insurance. No insurance company covers that in terms of eye corrections. Uh, Birth control treatments, male or female, uh, whatever treatment that go to control birth, that those are not covered under insurance. Insurance does not cover them for whatever the cost. Hearing loss, to get back hearing, the cochlear, uh, aids, the hearing aids, all these things are not covered under insurance. So this is the basic things that you should know, that these things are not covered under insurance. Even if you are kind of, I would say, uh, if you even if you're insured for 5, 7, 10 years, 20 years, these conditions are still not covered under insurance. They are permanent general exclusions. Then we have something called permanent exclusions. These permanent exclusions mean that if these conditions, the person who's getting insured has any of these conditions, then he cannot get insurance at all. He is not insurable. He is denied insurance. So let us understand what are these conditions that we are talking about. Malignant neoplasms, any cancer, any kind of malignant cancer, could be on the lip, nose, throat, lung, any part of the body. If he already had it and then he is cured, still he is not insurable because it could relapse. That's the idea, that that could relapse again, and no insurance company wants to take a call in terms of any cancer patient. They don't insure them until unless they know for sure that that was not malignant, and he is cured completely out of it. So that is the thing that they talk about. Any person who's epilepsy patient, generally called fits. So in normal thing, in normal language we call fits. This fits is not, person who's got fits is not insurable. He cannot avail insurance at all for lifetime. When I say heart ailments, congenital heart disease also and valvular heart disease also. If somebody is already having that, then he is not insurable. Then we have something called cerebrovascular diseases. A person who has already had stroke sometime before and now he's cured. Still, he cannot. If he mentions that he's got cerebrovascular disease earlier and is cured, he may not be insurable for lifetime. Uh, Somebody who is already facing this inflammatory bowel disease, kind of ulcers and Crohn diseases, they are not insurable. No company would want to insure them because you never know when it will, to where it will lead to. So they are not insurable. Chronic liver diseases, not insurable. When I say chronic liver, anything to do with liver diseases, if it is uh, kind of over a period of time it's happened and it will continue for life, we can't insure such people. Pancreatic, same thing. Anything to do with pancreas, uh, except for diabetic condition. If pancreas itself is affected and is not work functioning, it has some chronic ailment in the pancreas, not insurable. Chronic kidney diseases. Somebody who's having kidney issues is on dialysis, not insurable. He may all. There are some people who have kind of donated kidney, not insurable. Somebody who has acquired or taken kidney of somebody else and using it, not insurable. Hepatitis B patient, not insurable. Alzheimer's diseases, not insurable. Parkinson diseases, not insurable. These are certain conditions where you should know that these conditions, the person who's gone through that before taking insurance is not insurable. Then we have HIV and AIDS, again not insurable. Someone who's with loss of hearing. Uh, when I say loss of hearing, he is 99.9%. He's got loss of hearing. He cannot hear. He's deaf. Such a person, again, not insurable. Somebody with multiple sclerosis, if he is already affected with that, not insurable. So please make sure that when you are healthy, when you are young, when you have the capacity to buy insurance, please insure yourself. And whenever you buy insurance, these conditions what we have mentioned today, what we have discussed today, all these conditions, you have to understand one thing, that in India, this is an IRA regulation and these conditions apply for all policies. So this is basic thing that you have to understand. So with this, I think I am done for the day. And if you want a detailed discussion on this, please call me at 98861 00026. And please don't forget to like, share, and subscribe to this channel. Have a nice day. Again, we'll meet up tomorrow with a new video and a new topic. Thank you and have a great day.